Hello, and welcome to this episode of Registered Nurses in Primary Care. I'm your host, Emily Patton. We are privileged to have Dr. Whitney Pollio and Ms. Naisha Johnson with us today. Dr. Pollio is an assistant professor at UAB School of Nursing and teaches primarily in the undergraduate pre-licensure community health courses. She also serves as a faculty member on the UAB School of Nursing HRSA grant titled Building a Resilient Primary Care Registered Nurse Workforce for Chronic Disease Prevention and Control in Alabama. We also have with us Ms. Johnson, a registered nurse at Bessemer Neighborhood Health Center, which is a federally qualified health center. She is the nurse for the medication-assisted therapy program at the clinic. Welcome, Dr. Pollio and Ms. Johnson.
Thank you.
So today we will be discussing the role of the primary care nurse. So what exactly do primary care nurses do?
I feel like a really good role for the primary care nurse is a triage. They're able to really help the workflow in the clinics, the primary care settings. They're able to talk with the patients and decide whether or not they need to go to the emergency room, be seen emergently, maybe be seen non-emergently, or even handled over the phone. They have training in pathophysiology and pharmacology where they can best assess the patient's situation and tailor the care to treat them best.
Do you have anything to add to that?
Yeah, I think overall it's just kind of management of chronic illnesses. That could be medication reconciliation, health education. Sometimes it's all about someone's not taking their medication correctly. That'll better manage their blood pressure, finding out what can you do outside of taking medication, eating better, smoking cessation, health assessment, community linkage to community resources, those type of things to manage chronic illnesses.
Okay. So what are the benefits of having a registered nurse in the primary care setting? We'll start with you, Ms. Johnson.
I think improved health outcomes, patient satisfaction, just kind of having someone that can go through the steps with the patient, each step of where they need to go, eliminating some healthcare disparities, improved use of community resources, those type of things.
Okay. Do you have anything to add, Dr. Pollio?
I think a really important aspect of the primary care registered nurse is patient advocate. I think if they wear that hat, that pretty much everything falls under that, making sure that your patients have competent, best cares, also making sure that they get the best treatments that are available, but also knowing to include them in their treatment options and their care planning. If you advocate for your patient and keep them involved in their care planning, then you can be more assured that you're going to have good patient outcomes.
Yeah, absolutely. So can you both tell us a little bit about some of the settings that primary care nurses work in?
Wow, there are so many patient care settings where primary care nurses work. Obviously, there's the primary care clinics where they assist the physicians and do a lot of the triage. Like I said before, there are also school nurses where, a lot of the kids, that's where they get the most care that they get is right there in the schools. There are health departments. There are also occupational health nurses. A lot of people don't know what the occupational health nurse does. They make sure that that the employees are safe in the environments they're working in, and that can be anywhere from making sure they have the immunizations that they need if they're working, with some sort of biological clinical trials. Also, if they're working with chemicals, they need the protective equipment to wear, special protective equipment like masks, and the occupational health nurses actually do the mask fittings for those things. So also there are specialty clinics. A lot of people wouldn't think that's a primary care setting, but with our world now, with all of the chronic diseases, diabetes, heart disease, COPD, all of those are chronic diseases that need management, and a bachelor's prepared registered nurse is the best one to do that.
Yeah, sure.
Also, situations like homeless shelters, sometimes it's on a volunteer basis, but coming in, making sure individuals there have the medication that they need, that those illnesses are managed there. Community health settings, mental health facilities, substance abuse facilities, individuals that are on abusing substances coming in, making sure that they have medications and that everything is managed so that they can recover from substance use.
Yeah. So, Ms. Johnson, you work in kind of a unique setting at a federally qualified health center. Can you tell us a little bit more about what that is?
Federally qualified health centers receive federal funds to provide services to individuals that are low income, maybe uninsured or underinsured. A lot of our services are based on income. And so if someone doesn't have income, then they won't have a copay to go with that. If you have a little bit of income, you may have a small copay. But we just want to make sure that cost is not a barrier to health care.
Absolutely. And additionally, you kind of subspecialize further into medication-assisted treatment or therapy. Can you tell us a little bit more about what that is as well?
Yes, medication-assisted treatment has been around for years. Methadone is one form of medication-assisted treatment, and abuse for alcohol is another form. At our clinic, we provide Suboxone for individuals that are suffering with opiate use disorders. And so the individuals will come in, they receive a full medical assessment, whether it's for medication-assisted treatment or if it's for medical. And so we just want to make sure that we're covering that whole spectrum. So if they come in for medication-assisted treatment, they're going to get a nursing assessment. That nursing assessment may identify other needs that they have medically, and so we want to make sure that we link them with our medical team to have all of those issues addressed.
Yeah. It's certainly very important in the world we're living in now with
Very much so.
the opioid crisis. It's a really great, unique role of an RN that people can consider. And then how about you, Dr. Polio? Any past experiences working as an RN that you would like to share with us? What kinds of settings you worked in?
I spent a lot of time in a rheumatologist's office. A lot of people don't know rheumatology is a subspecialty of internal medicine. So we wore both hats for that as far as managing a chronic disease, but also providing primary care. So that was a unique setting as far as helping those patients.
What were your roles and responsibilities as a registered nurse in that type of setting?
It's very interesting when you work in a primary care setting with a physician, how much autonomy some physicians will give you. He used to have me go in and do a 7-page history on them. And would really rely on me being able to ask the right questions and get the, enough information out of the patients for him to be able to form the right diagnosis for them.
Awesome. Okay. Well, is there anything that either of you would like to add or any references you'd like to point our viewers to?
Just the importance of the primary care nurse, especially I think into the future as our population ages. Primary care RNs are going to be very, very important. We're going to have to adjust our current model of healthcare, and make sure we're educating RNs and making sure that they know the importance of the primary care nurse.
Sure. I'm glad you pointed that out.
Yeah, and also with all of the chronic disease now, as Ms. Johnson said, the elderly population is becoming one of the largest ones. We're living longer. Our treatments are better. However, that means more of us are having chronic conditions that need to be managed, and they don't need to come into the hospital for those sort of things. So we need the training of primary care RNs to be able to manage those clients outside of the hospital.
Sure. Well, thank you both for joining us today, and thank you to everybody who's tuned in for this episode. It certainly has been very informative and taught us a lot about the role of the primary care registered nurse. We hope you join us for our next episode of Registered Nurses in Primary Care.